Delivering high-quality healthcare services in a safe environment while fulfilling your organization's mission, vision, and values requires an understanding of trauma-informed care. Understanding these principles will provide guidance for handling disruptive behaviors by establishing clear expectations and effective communications with clients who are experiencing emotional dysregulation. Our understanding of trauma can help us mitigate risk while creating a safe and healing environment for both patients and staff by using respectful and restorative approaches. Traumatic stress responses are normal reactions to abnormal circumstances. Let's keep a few things in mind. Individuals with trauma histories often have an overreactive survival brain. Fight, flight, or freeze responses are automatic, physiological responses, not cognitive choices. This means that the potential danger and difficulty flooding of emotions more rapidly triggers panic and survival reactions. The best way to support a trauma survivor is by rendering the following. Physical safety is the need to experience comfort and feel safe in the physical environment. Psychological safety is the feeling of belonging, trust, and respect that they experience.
So having this in mind, what is a crisis? A crisis happens when an individual experiences something that provokes stressful or difficult feelings, and their experience or perception of the situation is that it is intolerably difficult. It exceeds their normal ability to cope, any coping mechanisms they have, and their current resources. When that happens, we see a behavior change. People act differently. And with that, there's usually an element of potential danger. Lastly, while dangerous, crisis can also be an opportunity to foster learning and promote growth. So now, let's talk about the different stages of the crisis volcano. Because like a crisis situation, individuals can have different stages of eruption. The first stage of the crisis volcano is the dormant stage. This describes an individual's normal, everyday state. They may experience some stressors and difficult emotions, but there's no discernible behavioral changes. Maybe there might be a little smoke.
Venting. Crisis has been triggered by the inability to cope. The lava is bubbling beneath the surface and the volcano is starting to smoke. The patient or the person may experience muscle tension, rigidity, they may start to curse, they may clench their fists, demonstrate an angry affect or angry face, they may start to fidget, pace back and forth, or become unresponsive.
The next stage is fuming. Here, the degree of stress and behavioral intensity is increasing even more. There is some lava now bubbling up over the surface. It's really smoking now. The degree of danger and risk is rapidly increasing. Here, you might see verbal aggression, threats, minor property destruction, and the individual appears enraged.
Eruption. The volcano has now exploded. The situation is completely unsafe. Here you will see the person demonstrate violence towards others, their self, or severe property destruction.
So crises can be scary, difficult, and destabilizing for all people involved in the situation, including you. So to properly engage with the individual and mitigate the risk associated with high-risk behaviors, if you're responding to crisis, you need to have a high level of self-awareness and self-regulation to be extremely intentional and strategic with responding to the person experiencing the stress as opposed to reacting to your own feelings. Self-awareness is key. Feelings of anger, fear, and anxiety are physical states in the brain that can impede cognitive processing and your decision-making. It makes it easy to do or say things that after the fact will say, why did I act so stupid? Because it takes your executive functioning offline. So in these moments of dangerous, scary crisis, strategic decision-making about what to do is essential, and it's also quite difficult. We need to be really intentional in doing that. We want to try to check as much as possible the danger of reacting to our own internal subjective feelings instead of responding to the feelings and needs of the individual in crisis. This means we got to be emotionally competent. This is going to make it easier for us to manage our own feelings and reactions, and that's going to make it easier to manage others and to demonstrate a degree of safety and calm.
Before we decide to intervene in the situation, we need to ask ourselves, what is going on with me? Most people's natural response to chaos and dangerous situations are fight, flight, or freeze reaction. The most important thing we can do in a crisis is try to respond rather than react. Responding instead of reacting requires self-awareness.
We also want to pay attention to what are your thoughts saying. If you could hear a tape recorder inside of your brain, what would you hear? What kind of messages are you telling yourself? Are your thoughts racing? Are you engaged in negative self-talk? Feeling panicked? Are you telling yourself, why is this person acting like this again? Or I can't believe I'm having to deal with that. Those negative messages can fuel negative feelings. We also want to pay attention to how our body's feeling. You want to be aware of your body's common reactions to stress, tension, and fear. Where in your body you're experiencing the stress. Your muscles feel tight, your stomach feel upset, you feel heat in your face. What emotions do you feel? How do you feel about the situation? How are you feeling about the individual in crisis? Also, we want to make sure that we recognize whatever values, beliefs, and worldview we may have that are going to affect how we think and feel about the situation and the individuals involved. All these areas are going to impact how we respond and behave. And there's some examples of how we can react to those feelings. It may drive us to reject the client, to pathologize them, to see them as hopeless, for ourselves to become defensive, as much as possible being aware of our thoughts and feelings, allow us to be responsive to the individual and not reacting to our stress, our feelings, or whatever negative messages we may be telling ourselves in our thoughts.
Assess the situation. Once the situation is safe, we can proceed. The most important thing we're going to do here is engage in active listening. And what does active listening do in the moment of crisis? Active listening demonstrates that you are attentive to what they are saying. This builds trust and is naturally calming. Active listening is an attempt to facilitate engagement and discover the deeper meaning of what they're trying to communicate. Active listening is listening to understand, not listening to craft a response. Effective active listening uses nonverbal techniques, questioning techniques, and responsive techniques. It gives you the opportunity to ground yourself and focus. You can demonstrate that you're listening without using a single word. Nonverbal techniques include the following. Silence. Silence is not passive, but sometimes it is done to facilitate conversation. Facial expressions. They demonstrate that you're actually interested. Be attuned and responsive. Avoid appearing judgmental. Eye contact. It should be soft and engaging without staring. Body language. Be open, don't cross your arms, and be nice and relaxed. Voice tone. You need to be calm and respectful. Keep it low and slow, but also responsive.
Building on your nonverbals, you also want to use some of these techniques to talk with the individual. Try to use the following. The first are reflective responses. So these are short statements where you show you understand and connect with the individual's feeling. You're using an educated guess about how an individual might feel and reflecting that back to them. It might be something like, I can see that you're feeling hopeless, or you sound defeated. It helps you get insight into the feelings and needs of the individual and helps the individual in crisis identify their feelings. The other is empathic statements. So these statements validate the person's general experience. It might be a statement like, that must be so hard. It sucks to have to feel that. It demonstrates a connection and attunement and is very validating and feels safe for the individual in crisis. Building on those, you also want to use questioning techniques. The first are your closed questions. Closed questions typically elicit a one-word or yes-no answers, and generally they should be avoided because they don't activate the thinking brain, which is what we're trying to facilitate. However, sometimes we need to solicit and clarify specific pieces of information, and so they can be strategically used to help promote the beginnings of talking out of a difficult situation. But while we're avoiding those closed questions, as much as possible, we're using open questions. So these questions should promote the individual telling a story about their lived experience in an undirected way. This allows them to vent and talk out their feelings and builds connection by you listening to them.
I really just need to talk to my therapist now.
Okay, you seem pretty upset.
I really don't want to talk to you. I just need to see her.
Okay. So you want to be able to talk to her right now?
Yes. And she ditched me and I need to tell her about my mom. And I feel like I just can't be here right now.
Okay. So you feel like she rejected you? There's something going on with your mom that you're worried about?
She has cancer. Well, I don't know. Supposedly, I'm not sure. Right. Honestly, I don't know what I'm thinking.
Yeah. So things are very overwhelming. You're really worried about your mom. There's a lot going on.
Yes.
And it feels like no one's helping you.
Yeah, nobody wants to help me.
That sucks. To feel kind of alone.
Yeah, and I don't want to talk to you. I just want to see her right now.
I feel that you don't want to talk to me. You feel like no one's helping you. It's hard.
Our goal as professionals is to treat patients with dignity and respect and recognize that our patients face many different challenges that may lead to high levels of stress, frustration, and occasional extreme disruption. Our ability to understand their needs and our responses to them will help us to be sensitive and proactive with our responses. Crisis can occur when someone encounters a stressor or trauma reminder that they are unable to cope with. This is manifested in a behavioral change. And there's many factors that impact that level of stress or arousal. Remember, crisis is not a static state, but a process of many different levels of stress, arousal, and behavior. Being able to identify these stages for the individual helps us determine how to respond.
So if you can identify and know where the individual is in the crisis volcano, it gives you important clues for determining what kind of intervention you need to use. So in doing that, we want to pay attention to their behaviors, how much they're erupting, and as much as possible, think about the following. What might the individual in crisis be feeling? What are they saying? What is their body language telling you? What might they be thinking? What do you know about the situation? What clues can you get? And do you have any sense about why this crisis is happening right now? Do you know what precipitated or triggered the crisis? Do you know anything about this individual's history? And then, what need might be expressed by the crisis? If you can determine or know any of these, this will help make sure that we're responding to the feelings and the needs beneath the behavior that are driving the stress and not just reacting to the behavior alone. We want to make sure that we focus on what the individual wants and their obstacles to getting that goal achieved. We want to empathize with their feelings, their concerns, and their choices. If we can do those things, then we begin to develop a shared idea about the problem and the goal and ally ourselves with them trying to achieve that goal. All throughout, we want to normalize the circumstances and, most importantly, normalize their feelings and their experience. If we're able to focus on the individual's feelings and needs, that helps us make sure that we avoid the following reactions to ourselves. We want to make sure that we aren't disagreeing with the individual, we're not criticizing, that we hold off any judgment, that we're not minimizing the individual's feelings. No matter what we think about their behavior, we have to put forward the message that their feelings are valid. You always want to avoid telling them to calm down. That is always counterproductive because they're in crisis because they don't have the skills to be able to calm down. Avoid any sorts of warnings or threats that are going to provoke feelings of unsafety and drive an escalation of the behavior. And overall, just being careful about not overwhelming the individual with information, even if you do have good information or suggestions. Overall, we want to make sure we're responding to the individual in crisis and their feelings to ensure that any personal judgment that we have don't affect our intervention.
Be careful not to engage in the power struggle. A common way that people intervening in crisis can enrage rather than de-escalate the situation is falling into the power struggle. You know that you're in the power struggle when you find yourself going back and forth with the person in crisis. Or you're arguing, you find that you're defending your authority or credibility. You might be issuing ultimatums. If you don't stop this, you're not coming back to the program or we're going to dismiss you. You will probably notice that you are angry or frustrated with the person in crisis and feel like the situation is completely out of control. Here's 4 steps that involve the power struggle. There's the situation, what occurred. There's the patient's thoughts about what occurred. Then their feelings associated with their thoughts, and ultimately our response as professionals. The main question you want to ask yourself, how do I get out of the power struggle? First, you need to identify that you're in the power struggle. Self-awareness is key. Then take a quick second to calm yourself down. And this occurs by taking a deep breath. Then you need to be aware of your self-talk. Remember, negative talk keeps you in the struggle. Positive talk gets you out of it. Here's a few helpful steps to remain calm and regain composure. Stop what you're doing and take a deep breath. Visualize how difficult it must be to walk in that person's shoes. Remember to separate the challenging behavior from the person. Reframe your role from being a fixer or a manager to being more of a listener and a facilitator. Allow the people time, space, and the ability to share their thoughts and feelings. And after you have checked yourself, try one of the following. Actively listen and be attuned to the emotions of the person in crisis. And maybe adjust your body language if it comes across as aggressive. Provide space, options, and time to consider. You may need to say, you know what, I'm sorry. Can we start over? In some situations, you had to take a step back and maybe someone else needs to intervene. Brian, I need to see my therapist right now, like right now.
I get you're real frustrated, Jose, but your therapist isn't here.
What do you mean she's not here? She's on the clock. She's getting paid right now. Can you understand that?
I see you're frustrated, but she's not here.
You can't page her. You can't call her. It's 2024. There's so much technology. You can reach her. Please call her.
There's nothing I can do. It's impossible for you to speak to your therapist right now.
Oh my gosh, Brian, why are you being such a lame, bro? Call her.
Can I help you make an appointment to meet with her some other time?
You can call her. You can help me. And you can stop being a lame. You can help me that way.
Okay, I can't do those things. I'm sorry that you're frustrated.
Oh my gosh.
What do you want me to do?
I want to talk to my therapist. You guys tell me, express your feelings and your concerns. And when I need to talk to her, she's nowhere to be found.
Okay, I'm just trying to help you, Jose.
Help me create obstacles. That's what you're doing. Oh my gosh.
Jose, I know it feels really overwhelming. I'm sorry I came off at you at first. Can you tell me what's going on? So the goal of using these techniques is to intervene at that lower levels of the crisis volcano. And we want to ensure the person experiencing stress is feeling seen, heard, and understood. To facilitate that process, we got to be aware of the different communication styles and perceptions that the individual in crisis might be experiencing. When keeping the front of our mind, how is the person in crisis experiencing us? So here we'll talk about 5 de-escalation techniques that you can use when the individuals are on those lower levels of the crisis volcano. The goal, of course, is to reduce the stress and increase their ability to regulate by helping their thinking brain come back online. The first is assist. If you can help the individual with whatever task is stressful, then this can help reduce some of the stress and help them get their thinking brain back online. 2, sympathetic signal. Sometimes just expressing care or concern for the individual, giving them descriptive praise, can help reduce stress. It feels good to have someone say they care about you. And this can also be as simple as a smile, a small compliment about their shoes, or a high five. Next is distraction. Here, you can encourage the individual to engage in some other activity to distract them from whatever may be driving the stress and increasing their behavioral intensity. 4th is steam off. Here, you're going to use your active listening skills, your questioning techniques, and your validating responses to try to engage the individual to help them drain off their feelings by talking it out and you facilitating them doing this in a safe context. And the last is appeal to self-interest. If you can help remind the individual of their goal in the situation and set yourself up to ally yourself with them, that can encourage problem solving and engagement of the thinking brain and seeing you as someone they want to work with to help in the situation.
They told me I can't see my therapist.
Jose, I can tell you're really frustrated. Could I try to help you make an appointment with your therapist?
They told me I can't see my therapist.
I can see, Jose, that you're real mad. You know, I care about you and I'm sorry you're feeling this way.
They told me I can't see my therapist.
Jose, you seem real upset right now.
I'm frustrated, Brian.
You know, it's pretty nice outside. Can we go maybe for a walk and we can talk about it a little more?
Sure.
Come with me.
Let's go.
Yeah.
They told me I can't see my therapist.
You seem real upset right now, Jose.
There's a lot going on, Brian.
Yeah, tell me what's going on.
I don't know what's going on. I just need to let this out somehow.
So you're feeling real overwhelmed.
That's a word for it.
I'm sorry.
They told me I can't see my therapist.
So you seem real frustrated right now.
I'm really frustrated, Brian.
So you want to see your therapist because you want someone to talk to.
Yes, this has to come out of my mind.
Okay. So can I help you find someone to talk to?
Sure. We all respond to stress in different ways. Some people's emotional dysregulation can cause them to decompensate and be on the verge of full eruption or erupt very quickly. On other occasions, our responses as professionals can intensify the situation. Failing to recognize the level of arousal that the person is experiencing and the impact of our responses can lead to further escalation and promote a full-on crisis. When the crisis is fuming and on the verge of full eruption, this is our last opportunity to engage or enrage, making what we think, do, and say highly important.
So when the crisis situation is fuming and you're on the verge of full eruption, the behavioral escalation looks like there might be violence. Here, this is our last opportunity to try to engage the individual and make sure that we do not enrage them. To do that, we're going to use the SMARTY technique. SMARTY stands for self-check, make space and be aware, and then respond to the individual. Sometimes, ensuring that we remain calm is really the best way to decrease the stress of the individual in crisis. So let's go through the SMARTY. The first is your self-check. You want to take a deep breath. Taking a deep breath regulates our default response. It gives us just a second of pause and helps with our blood pressure and pulse rate. Then we want to do a quick awareness scan of yourself and the situation. Most people's lived experience makes it where they jump into situations without thinking about how they're feeling and without thinking about their body. Self-awareness is doing that quick self-check so you're not reacting to that when you're intervening in these situations. The next step is to make space and be aware during the crisis. Most importantly, you want to stand in a way that is non-threatening to the individual in crisis. You want to stand at an angle with your shoulders twisted to the side, minimum 6 to 8 feet away from the individual in crisis. You want to keep your feet apart and standing on the balls of your feet. You want to demonstrate that you're calm, but also you're able to move if you need to respond to keep yourself safe. We want to make sure that we're relaxed, demonstrating that we're calm, but alert in case we need to respond. Keep your hands down, but visible, and keep a calm and responsive facial expression. We don't want to be a blank slate, but responsive to the individual's feelings and concerns. Lower your profile. If you can, lean against a wall, sit on a desk, doing so in a way that maintains your ability to move quickly if need be, but it shows a non-threatening body language. Overall, we want to be extremely attuned to our body language, our facial expressions, and how we're standing, because that speaks volumes to the individual in crisis.
Responding to the individual. Use active listening skills to attempt to engage the individual in crisis. The use of silence is still very important. You want to speak low and you want to speak slow. Use reflective responses and empathetic statements to validate the person's experience. Naming the feeling tames the feeling. For example, you seem upset right now. Use their name to attempt to connect. For example, Louis, you seem frustrated. Remind them of the relationship if you have one. I know we can get through this. We have done this before. You can offer a way out of the crisis. For example, you can say, let's talk about this and let's go for a walk. Don't make any promises you can keep and try not to bargain. The most important thing is to validate, and then you're going to validate a little more. You potentially want to scan for weapons, and remember, anything around you could be used as a weapon. Assess the situation non-verbally, and always keep your eyes on the exits. Oh my God, I can't believe another bad thing happened to me, Brian. Another bad thing.
You seem real upset, Jose.
I'm frustrated. I lost my job. My mom got diagnosed with cancer today. Can you believe that?
That's so
hard. Oh my
hard.
gosh.
Yeah.
Oh my gosh, this is crazy. What am I going to do?
So you're real overwhelmed. A lot of bad stuff have happened.
Oh, I'm going to go crazy. What am I going to do without my mom? Dude, without my mom?
That's so scary.
It's nuts.
I get that you're really worried about her and what's going to happen.
I'm scared, Brian. I'm confused. I'm worried. I don't know what else I'm feeling right now. It's too much.
So it's all just welled up.
It's inside. It's here. It's in my back, everywhere. I feel like I have to destroy something,
Right.
break something. I don't know. What do I do?
So you don't know what else to do.
I'm frustrated, Brian.
That's hard. That's hard.
This is nuts. Can you imagine your mom passing away?
I can't imagine how
I'm
scary
facing that
would-
right now.
Yeah.
That's nuts.
That's a hard thing to face. It's scary and it
Wow.
feels like things are out of your control.
Yeah, it feels that all the bad things in the world get put together and they give them to me.
Right. That doesn't feel fair.
I'm in shock right now. I don't even know what to think.
Yeah. Do you think you could sit down, Jose, and just kind of tell me the whole story? I know there's a lot of feelings.
I don't know if I can even sit down, Brian. There's too much inside me right now. I'm so wired up.
Yeah. I get that.
This is nuts.
Yeah, it's a lot of bad stuff. Hard to handle.
I don't even know where to start, dude.
I get it's really scary and feeling kind of alone. Why don't you sit down?
I'll try, Brian.
me everything
This
that's
is
going
tough.
Yeah, I get it. So, tell me what happened. Every crisis, while dangerous, is also an opportunity for learning. Debriefing the situation is an important aspect of doing effective de-escalation. If done well, it leads to both healing and also learning from the situation. So once you've entered that cooling phase and the person experiencing the crisis is beginning to calm, then we can help them learn from that experience by getting them to take steps towards entering and using their thinking brain. These techniques can help the person leading the interventions learn ways to examine their approaches, modify engagement strategies, and then to lead group debriefs in order to implement better standards of care across your agency.
If your intervention is successful, the person in crisis can be engaged. They are demonstrating steps towards the thinking brain activity. At this stage of the crisis volcano, your interventions can both decrease the emotional intensity and likely promote learning about the situation. Crisis situations can be incredibly challenging for everyone involved. Post-crisis engagement is crucial to keep the therapeutic relationship going. After a crisis, people may disengage for several reasons. They may feel embarrassed because of how they act. They may not feel welcome back to the program. They may blame staff for the crisis. Whatever the reason is, it is our job to re-engage the person. Trust and rapport may have been fractured in the process. We need to reassure the people that they are still valuable and they belong on the team. Explore what happened and any potential triggers. Help develop a plan for future crises. Share your experience in a very sensitive way. During the cool-off process, move the conversation to a quiet and less stimulating location. Then you want to put your journalism hat on. You want to get all the details. Encourage them to share their point of view on the situation. And get a detailed picture in order. Validate the experience throughout the conversation and link the understanding emotion. Promote the use of coping strategies, and finally agree on the next steps.
So Sylvia, I know you got a lot going on, but thanks for coming in and talking to me.
Sure.
Tell me what happened.
I mean, so last week I lost my job, and then today I went to take my mom to the doctor, and apparently she probably has cancer.
Oh no.
Mm-hmm.
So you're already frustrated about losing your job, and then you get this news about your mom.
Yeah,
How'd that feel?
it sucks.
Yeah.
It's not fair.
So it feels unfair,
Mm-hmm.
kind of worried, scared about what's going to happen.
Yeah, and I'm angry
Why angry?
because I feel like I'm not a terrible person. I don't know why all these bad things happen.
Right. So it doesn't feel fair that bad things happen to you.
Mm-hmm.
That sucks.
Yeah.
So you were feeling these things, and then you went to come in today, and talk me through then what happened.
Oh, God, I came in and my therapist ditched me, apparently. I mean, I was late. I know that. It's not my fault. I got pulled over and, it's just, and I was coming from the doctor and she left.
So you're already feeling these overwhelming feelings.
Mm-hmm.
You have problem on the way in, feel more frustrated, come in, therapist isn't there, you're feeling rejected by them, and what else?
Well, I mean, I wanted to talk to her, and our session's like an hour. I don't understand why she left. I mean, I get it, but it's still pretty frustrating.
So it felt sort of personal,
Mm-hmm.
but mostly you also wanted to just talk about these feelings that have been welling up. So you came in feeling all this, and they said she's not here, and then what happened?
Well, I threw a chair
Okay.
because they were just telling me I couldn't see her, and I was just very overwhelmed.
Right. It was hard to take that information in. You get angry with them, and then you said you threw the chair.
I did.
Okay. And what happened after that?
Well, then somebody came to talk to me and offered me to talk to you, which I appreciated.
So I'm glad you came in and talked to me. And how are you feeling now?
A little bit calmer.
Yeah.
At least that I'm here.
Right. But I know the worry about your mom and the frustration with the job and stuff is still there.
Oh, of course. Yeah. My body's a little tense. I can
Yeah.
tell.
So what can we do about that? Like, what do you need right now?
I mean, right now, I just need to know that I'm going to talk to my therapist soon. I can't wait. I don't want to feel this way for too long.
Right. So you really want to get those feelings out and talk to someone. I mean, if you were to come in again and you find that therapist isn't there or something else that's frustrating, what do you think you can do?
I mean, I should probably go for a walk
Okay.
before and then come back and ask them to reschedule.
Okay. So next time you get that frustration, feeling overwhelmed with all these feelings, going and taking a walk and then coming back would be something that'd be helpful?
Yeah, I think so.
Okay.
Mm-hmm.
And what can I do to help you right now?
If you could just reschedule me, I'd appreciate that, and just let her know, that I really need to see her soon.
Okay. I'll for sure help you reschedule. Going forward, I know that this is going to be a hard time for you, and feel free to reach out to me. And I'm happy to talk with you whenever I can about these feelings because we care about you.
Thank you. I appreciate that.
Yeah.
Mm-hmm.